Um, I just want to formally welcome you to our web conference today, Greening and Growing Part 2, Innovative Strategies to Create Protective Environments. My name is Ashley Klein-Jimenez. I use she and her pronouns, and I am with Valor and Prevent Connect. Prevent Connect is a national project of Valor US, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or Valor. I almost memorized that. I just want you all to know. So now I am very excited to introduce you to our facilitators today. Lisa Fugia Parks and Sophia Veto are with Prevention Institute. And Lisa, Sophia, welcome. How are you both doing today? I want to hand this over to you because you're going to lead us through this great discussion with our guests. I need to make Sophia the host, the co-host. So let me do that. That would explain. Sorry about that, Sophia. Here I come. All right. You should be able to unmute yourself now.
Okay, hi, thank you. That was such a weird sensation. Yes, I'm Sophia. It's so nice to be back with Prevent Connect. And I think I will just kick us off with the objectives on the next slide for this session. So we are here to discuss practical tips and lessons learned about implementing place-based strategies to prevent sexual and domestic violence, explore the importance of strengths-based community-centered approaches to place-based work that includes civic engagement, and to learn about CDC resources to support place-based strategies to prevent sexual and domestic violence. Next slide, please. So if you're able to raise your hand, or if you want to just drop in the chat to let us know if you've attended part 1, Greening and Growing Strategies to Create Protective Environments and Prevent Sexual and Domestic Violence. We'd love to get a read for how many of y'all were there for part 1 and came back for this part 2. So during session 1, which you can listen to on Prevent Connect's website if you did miss it, we reminded participants about the Creating Protective Environment strategy in the CDC Resources for Action documents, and hosted Josef and Amanda from Michigan Coalition to End Domestic and Sexual Violence, who we will hear from again today, and Darlene Thomas from Greenhouse 17. We also talked about acknowledging the history of colonization in the US and the need to approach efforts that relate to land and environment with a commitment to solidarity with Indigenous people and nations. I'm seeing a couple hand raises, and oh, Bella says it was great. Thank you. That's so great to hear. I also really enjoyed the first session. Okay, next slide, please. So here is the definition of greening that Josef and Amanda offered that tells us that the goal of greening isn't always to only increase greenery, but to increase social connection and to be in community with one another in safe and accessible environments. Josef and Amanda will provide a more detailed recap later on in their presentation, but just wanted to offer this as we get started. And next slide, please. And then we also had Darlene Thomas, who is the executive director of Greenhouse 17, a nonprofit advocacy organization that nurtures lives harmed by intimate partner violence in 17 central Kentucky counties. They shared their journey to create a shelter that survivors are proud to live and thrive in on a 40-acre property. Greenhouse 17 invites the local community to support the survivors and the organization's journey by purchasing self-care products that are made by the survivors on the farm. They sell it at the farmers market and online if you want to check that out. The community is able to participate in events on the grounds and a lot more other opportunities. The program itself creates opportunities for nature-based healing, job training for survivors, and farming nutritious produce. And Darlene and her team are really working to transform trauma into resilience and strength and championing the idea that survivors are a blessing and not a burden, which she said very elegantly in her presentation last session. So I encourage you all to go watch the first screening and growing session on Prevent Connect's website, and you can hear more about Greenhouse 17 in detail and everything that Joseph and Amanda also shared. So with that recap, I want to introduce our first speaker. This is Calla Jamison. She is a health scientist in the Division of Violence Prevention at the Centers for Disease Control and Prevention, who focuses on evaluation, capacity building, and health equity. Passing it to Calla.
Thank you, Sophia. All right. Okay. Just checking I have control of the slides. I have all the controls. So thank you so much. Like Sophia said, I'm Calla Jamison. I'm on the Technical Assistance Coordination and Translation team in PPTB. And I'm super excited to be here with you all today to talk about this topic and have the opportunity to present on the resource, the Estimated Essential Elements of Place-Based Approaches resource for recipients. So this resource went out to the listservs, and I'll make sure that we link to it in the chat as well. The development of the resource actually began several years ago during Delta Impact. We held discussions with the implementers at the Michigan Coalition, who you'll hear from again today, who were conducting greening in several different communities, and we wanted to work with them to document what are the core components or the essential elements, the necessary pieces to make greening for violence prevention work, because there's not a ton of guidance out there. So their expertise was vital to the process. And to structure the development of our resource, we followed the essential elements framework. Some of you might already be familiar with select, adapt, evaluate, and the essential elements. But as a reminder, the essential elements are the what, the how, and the who that we think are responsible for a prevention effort's outcomes. So they're the components that should be included in an approach. So the essential elements are the what approach content and standards that should be delivered, how they should be delivered, and the characteristics of who should ideally deliver or lead an approach. And we estimate essential elements to help practitioners understand how a prevention approach is intended to work and the potential consequences of making adaptations or changing that affect the what, how, and who that you've identified. This is a useful framework for this work because it allows for flexibility and tailoring to the context of where an approach is being implemented. And of course, this is always important, but particularly significant given place-based approaches relationship to place, of course, context, and community. So to estimate the essential elements, we consulted the literature and several recipients' deliverables and documents and discussed the process of planning and implementation with those who were doing the work. And we started the conversation with greening approaches, but we made it more general to place-based approaches so that it's applicable to more activities. Greening is a type of place-based approach, but there are others to which this resource can be relevant. And before I dive in, I just want to point out that a thread that's woven throughout the what, the how, and the who is the significance of the community where the work is being conducted. So it's critical to involve community members and residents and leaders throughout the process from planning, implementation, and evaluation. All right, navigating my two screens. So we're jumping into the essential elements, the what essential elements. And the document includes why each element is important and an example of it in practice, but I'm just going to highlight the essential elements for time's sake. So the place-based approaches reimagine and create neighborhood spaces to make them more welcoming, usable, or accessible. So the crux of place-based approaches is the modification to the physical environment to promote social cohesion through safe communal spaces. And they focus on promoting health equity throughout the process, but particularly by concentrating efforts on communities or settings that are most at risk for experiencing violence, and making sure any approaches that are implemented are sustainable. And they seek to understand the root causes of violence, including the social determinants of health. And any messages, they have a clear and consistent message that focus on the root cause of violence and the relationship between place-based strategies and violence prevention. You know, some of our partners might not know that relationship and why it's important, and a clear message on the vision of the project and the root causes of violence will more effectively create support and can transform any negative narratives there are about a space. Finally, approaches are tailored, the activities and interventions are tailored to the local context, including the cultural, social, and historical context and how they impact violence. Okay, I'm getting into the how essential elements. Starting with using local data to understand neighborhood assets and gaps to improve planning and focus resources effectively and equitably. And the revitalized or newly created spaces are welcoming and accessible to all residents and include features that promote community connectedness, such as play spaces, benches, and community gardens. So the success of a place-based approach is really tied to residents both having access to the space and wanting to use it. And importantly, there's significant investment in creating and maintaining relationships with community leaders and engaging them throughout the process of development and implementation. So informal and formal relationships promote community support and increase sustainability. And place-based approaches, collaboration, and shared ownership among partners are crucial. And there's a shared vision developed with partners based on the community priorities to guide project goals and implementation. And you work with local partners to identify potential consequences and impacts of the initiative throughout the development and implementation process. So those potentially negative unintended consequences are prepared for and monitored. Finally, place-based approaches build power and capacity within the community to address local issues such as violence. So part of the success of place-based initiatives is related to the power built in community members to engage in decision-making processes that affect their community. Finally, the who. Okay, didn't realize I animated it that much. But so you engage a wide range of individuals and organizations in the public and private sectors to lead efforts that may include but are not limited to this list. This is not a comprehensive list. But I also just want to reiterate that residents and community members and community leaders should be, and anyone who will be directly impacted by the place-based effort should be engaged in the processes. As we know, residents are the experts on their neighborhood, and any initiative not involving them will lack crucial information and be less sustainable and less equitable. All right, that sums up our essential elements. The resource also contains some links and tips and tools. So in addition to this estimated essential elements, there's implementation considerations and data tools. There's evaluation considerations, including example outcomes and indicators, and a selection of key concepts such as built environment. I also wanted to point you to Veto Violence's Violence Prevention in Practice, the approach summary for greening, as well as the IPB Resource for Action, formerly known as the Technical Package, which includes greening. So Greening is an approach within the modified physical and social environment strategy, and it has strong evidence for several types of violence. And while we recognize there is not robust research for sexual violence specifically, the Division of Violence Prevention's emphasis on shared risk and protective factors and doing work across multiple types of violence make it evidence informed for sexual violence, in addition to intimate partner violence and youth and community violence. So it is an approved evidence-informed activity for RPE as well as for Delta. Additionally, PPTD recipients are encouraged to engage in activities that aren't necessarily explicitly included in the resources for action, but that demonstrate a link between the activity and the desired outcomes of decreased risk and increased protective factors. So greening, as well as other place-based approaches, foster positive interactions and promote social connectedness and community support, all of which are protective against sexual violence and IPV. And this work helps to build the evidence base for emerging practices and activities through evaluation. All right, I know that was a lot of information, and I will share that resource that I discussed, but are there any questions?
Hi, Calla. This is Lisa, and it looks like there are no questions coming in the chat. But yeah, folks, feel free to put any questions there for Calla if you have questions about anything that she said or anything about the resources or how they're intended to be used. And yeah, we can also circle back if folks have questions later. But it sounds like what you presented was very clear. So thank you.
All right, thank you. And just a reminder that if you have any questions that pop up after the call, feel free to reach out to your project officer and they will loop me in. Thank you.
Thanks, Calla. I think we can go ahead and shift to our next presenter then, if nothing else is coming up in the chat. Yeah. Janae, can you put it on the next? Yeah, thanks. Okay, so our next presenter is Dr. Katherine Theall. She is a professor at Tulane University School of Public Health, director of the Mary Amelia Center for Women's Health Equity Research, and senior director of the Tulane Violence Prevention Institute. As a social epidemiologist, her research focuses on reducing health inequities by understanding and altering neighborhood environments and social policies for better health in underserved populations locally, nationally, and internationally.
Great. Hi, everyone. Oops, my first time with Zoom Advanced, so bear with me. It's great to be with you all today. And I did watch the first webinar too, and it's just a great conversation. You're doing really important work, so super exciting to hear more about that. And excited to be here to talk to you about some of my work. I am a social epidemiologist by training, and so a lot of my work focuses in the space of neighborhoods and how they produce health and health inequities and how we can change them. And I use she, her pronouns, and I will give you a little run of the mill first before we jump into things. But what I'd like to do is talk a bit about the context. What I will present today is one of our studies in New Orleans, Louisiana, here in the South, and then some background work that led us to this point to conduct this massive randomized control trial, which we affectionately call the Healthy Neighborhoods Project. So I'll talk a bit about that project and its preliminary impact on family violence and domestic violence. And then really want, and I'm excited to be in this space with all of you to talk about some lessons learned, some next steps, some things that we're struggling with as, you know, coming at it from research in a very academic aspect with a grant that is almost over, and how we sustain this work. So that's kind of the idea for today. I want to first also thank all of my wonderful co-investigators, Dr. Charlie Brannis, who's done a lot of similar work in Philly, Dr. Lisa Richardson, who is my co-PI for a Robert Wood Johnson sponsored portion of this work and is Director of Research and Evaluation at the Institute of Women and Ethnic Studies, and then other co-investigators, students, staff, and of course the study participants who really made a lot of the work possible. I want to acknowledge too that for the Healthy Neighborhoods Project, our key partners other than IWES and Columbia are and have been the Center for Employment Opportunities, CEO Works, which is a reentry program here locally in New Orleans, but they're also all over the country. And they really have been the driver for a lot of our greening and remediation efforts. And then also the City of New Orleans. We partnered with the Code Enforcement Division. We work closely with the Health Department, and we could talk about this at the end, but our partner for Healthy Neighborhoods was really Code Enforcement. So a pretty new adventure for me as a public health practitioner, again, kind of working in that space. So a bit of context for many of you who may not know New Orleans. Again, we sit at the boot of Louisiana down in the South. And as you can see here, we rank pretty much last or highest on negative health indicators. So, we have a long way to go with respect to health and particularly health inequities. And for violence, we are one of the most violent states, particularly for firearm violence, but also other forms. Some older data, and I think this is still true today, ranked us as about second in the country in the rate of women murdered by men. This is particularly true for also maternal mortality. Some of our work has, really shown the light on partner homicide being one of the big drivers of maternal mortality here in the state and in the city too. So that's kind of the space we're working in. We locally, more hyper locally in New Orleans, our neighborhoods were shaped, of course, dramatically by Hurricane Katrina, which destroyed about 70+% of the homes across the city. It's really transformed, much of the city since that time. But even pre-Katrina, New Orleans suffered with a vacant and abandoned housing problem long before that. So it was only made worse by the storm. And there's been a lot of effort since then to revitalize. But, our neighborhoods here in New Orleans have also been shaped by historic patterns, particularly redlining. And shown here is a map of redlining in 1939. And you can see the red areas of the city. I don't know if you can see my pointer, but the Mississippi River is that little winding river down south, and then we have Lake Pontchartrain to the north. But these neighborhoods in red were those areas redlined, and they are still neighborhoods to this day that, we see most violent crime, disinvestment, similar picture across cities across the US, as you all know. So a lot of things have shaped our context. Looking at, domestic violence in particular, and this is a map to your right that depicts in orange the rate of domestic calls, crime calls to 911 across the city. And again, you can see the darker hues of orange indicate higher rates. Again, kind of mapped historically along those redlining maps, we see a lot of similarities in location. And then the purple dots are vacant and abandoned or blighted properties. We can see these two things are highly correlated with areas experiencing higher rates of domestic violence, also having much higher volumes of vacant and abandoned property. And that is statistically significant. We, locally, we got into this work. A lot of my work has been on, I do a lot with community violence, but also just understanding domestic and family violence and intimate partner violence and its role really at a community level. But we also conduct a lot of cohort studies. And so I have one cohort study shown here. This is a cohort of adults living with HIV. And what we found are those who report higher experiences of IPV are also living in neighborhoods with greater rates of vacant and abandoned property. So again, very correlational, but kind of thinking about vacant and abandoned property as a key source of stress, of exposure in a neighborhood that might be related to IPV, but also other health outcomes and behaviors. We have a small maternal child cohort of mothers and children followed over time, very racially and ethnically diverse sample. And again, we found in this cohort that families living in neighborhoods with high vacant property rates experience greater likelihoods of physical or psychological maltreatment or neglect, with about a twofold increased likelihood. And again, this increase for each unit increase of blighted or vacant and abandoned property in the neighborhood. So pretty clear that, again, vacant and abandoned property is a key stressor playing a role in a lot of our ecologic data, but also, some individual level data that we have here locally in the city. So, we, after, trying to study this much more, we also partnered with code enforcement along with Dr. Brannis and, some other colleagues of mine it was probably 2017, 2016. And the code enforcement division post Katrina had implemented what they called a Fight the Blight program in the city. And so they were remediating, greening, basic mowing mainly of vacant lots across the city. And we used that to create sort of a natural experiment where we took remediated lots, matched them with control lots. There were about 200 remediated lots, and we had about 600 matched controls. Michelle Kondo, Chris Morrison, and our team did all of these analyses. And this was a doctoral student from Columbia who ran this study. But what we wanted to see was, did this remediation have an impact on domestic violence? And the time frame there was 2011 to 2017. And interestingly, what we found, this was published in Health and Place shown here, we found that overall, over that time frame, domestic violence crimes increased across neighborhoods, and neighborhoods here were defined as census tracts, which is interesting. But we did find a moderating effect by bar density. So the availability of bars, oops, I don't think my animation is popping up. The availability of bars in a neighborhood too. So we found that the increase was actually lower. So that top set of the red and the blue line, that blue line is the rate of domestic crime calls in these neighborhoods for lots that were in maximum bar density neighborhoods, if that makes sense. So the increase was lower in those areas as opposed to other areas. And so this was a little bit counterintuitive in some way, although thinking about it, we thought, well, the idea about remediating lots and increasing maybe social capital and cohesion, perhaps neighbors are more likely to intervene, more likely to notice events going on. It could explain that increase across time. How it's lower in areas with greater bar density is still in question, but there's some hypotheses there as well. So ecological study, very correlational, but has led us to, start thinking about what more we can do. How can we test this across different outcomes? And so what we found in that previous work and trying to secure some funding on this, again, working with code enforcement all the while to think about what we could do and would this be feasible to think of a larger scale study across the city that remediates vacant lots as well as vacant homes and then test that impact. And so we were supported by NIH initially to conduct a very large 3-arm cluster randomized trial that took some of the components of trials that had been conducted in Philly and other studies and sort of had 3 components. We had a control group of clusters, but then we also had clusters where we cleaned and greened the vacant lots. And then we had clusters where we did some remediation on buildings, and these were mostly vacant homes. And so those clusters with buildings had homes and vacant lots. And so kind of a 3-arm trial in that sense. And our goal was to look at, traditional studies that have been done across the country have seen substantial impacts with respect to firearm violence, other forms of violence and crime. We really wanted to focus on youth and family violence and whether we could, see an impact in these outcomes with this trial and this intervention. But we also wanted to look at community and health interconnectedness, sense of well-being, sense of safety. I'm not going to talk about all that today, but these are some other outcomes that we were interested in looking at that RWJF also supported. And then one other thing we were really interested in thinking about was if the impact is, if this intervention works, is it more or less effective based on what else is in the neighborhood? And so we're really concerned with that moderating effect of, let's say, alcohol density or park availability, or just other aspects of the neighborhood that might, again, moderate the impact of the intervention. And so that was a big component of what we also are looking at, delving into quite a bit. And so I probably don't need to tell you all how this works. It's kind of, a theory of how this might be. When I tell people about Healthy Neighborhoods Project, and particularly with family and domestic violence, I think, what? How can greening vacant lots and remediating vacant homes impact domestic violence? And so it is a big black box. And I think we still have a long way to go with understanding those, all of those mechanisms. But one of our, our theories are related to social cohesion control, and that disorder, vacant lots, and sorry, my animation popped up too early for this part, lead to potentially some fear, maybe withdrawal in the neighborhood of residents, stress as well, which can relate to violence within the home. All of these, if neighbors aren't out and about, aren't creating that cohesion and capital, it could lead to weaker social control, which of course could lead to potentially less intervening on violence and crime and more serious crime. And it's just, a vicious cycle that we are trying to stop with our efforts, and all of your efforts with greening as well. So sorry that animation didn't work, but we want happy families, happy people, happy residents. And so we started this trial we started it in 2018. We started the baseline data collection in 2018. The treatment itself, because we wanted a, long enough pre-period, the treatment itself did not start until 2020. And unfortunately, it was, right in the middle of COVID. But we did continue our treatment through December 2022. So we had a, pretty long follow-up for these lots, these parcels over time. And over time, we had almost 300 parcels treated. That included mostly vacant lots. We had about 60, almost 60 homes. And shown here in the picture, the top picture is a before and after of our cleaning and greening arm for the vacant lots. And so you can see, included removing debris, mowing the grass, putting up a fence where we could. We could not install this small fence on every lot just due to legal restrictions, but we did have fences on about 30% of those vacant lots. And so that was our, kind of treatment. Once the lot or the parcel was treated, we maintained. So crews would go back and mow the grass, remove any, new debris or dumping about every 2 weeks in the heavy growing months. Although here in New Orleans in the South, our heavy growing season is always. So it was about every 2 weeks, but give or take some, sometimes it was every month. And then for the homes, down on the bottom hand side is a picture of a vacant home. And the idea was to make these homes just look lived in. So coat of paint, maybe replace a door, a window. We're not totally remediating the home at all. And we only are treating the forward facing side of the home. So in this case, this home you can't see, but is, bordered by 2 additional homes. So we were just treating that front facing portion of the home. If a home was on the corner, we would treat, all of the sides that were visible from the street. And so again, treating the home, we would go back again to these parcels as well and mow the grass and kind of keep them up as well from a maintenance phase. And so over that time, we are still maintaining 160 of these lots and vacant homes. We had a lot of loss to follow up with turnover. Some of the homes were sold or demolished. Some of the lots, of course, were repurposed and used. Most of them were privately owned. We had a few owned by the city and 2. And so we had to really work legally to be on these lots with CEO Works, able to treat them. We just started last summer treating parcels in our control clusters. And so we have almost 200 clusters across the city, which I'll show you a visual, and treated all of the treatment clusters. And then we finally wanted to treat the control clusters, which started this past summer. So we're doing the same thing in these control clusters. This is kind of hard to see probably on the screen, but these little red circles were our small geographic clusters. And so that was the unit that was randomized. And those little yellow dots were vacant and abandoned property across the city. So again, 200 clusters, give or take, I think 194. And we randomized in blocks. So areas of the city, we randomized in New Orleans East, the West Bank, which is kind of south of the river, and then the rest of the city, just so we could ensure we had enough intervention and control clusters in each area. And so we followed clusters over time as one unit of analysis. And again, treating them all now until we run out of funds. We're going to keep this up. And then we also, within these clusters, so in terms of data collection, we had secondary data, which I'll show you in a bit, and that just included available data that we could collect within the clusters and analyze the impact. But we also created a cohort of residents who lived in these clusters. And we had about 400 individuals followed over 2 years. We had 5 waves of data collected and about 65% retention, which wasn't as bad as we thought for it being COVID for sure. And we did computer-based interviewer administered surveys. We had some text-based collection. We also did focus groups, which I'll show you in a bit, key informant interviews. And then we really wanted to do ethnographic observation. Given COVID, it kind of wasn't possible, but we're thinking about that right now for the control areas, because I do think that would be a really rich source of data. And so to give you a sense, so these are our baseline participants, about 400, roughly a third were male or self-identifying as male. Mean age was 52. We had quite a range. So residents were 18 to 93 years. Not many Latin or Hispanic ethnicity, and then the majority self-identified as Black or African-American, and about 40% were high school graduates or less, about 35% employed full-time, and some of the rest is cut off on my screen. But for this audience too, we did capture some survey items related to intimate partner violence, as well as child abuse and maltreatment. And so we used the HIT scale, which is hurts, insults, threatens, and screams. And we added an additional question to that series of questions on whether your partner restricts your actions. And so these were all on the Likert scale, and we categorized those as a score of 5 or more once they were summarized. And so that indicated some level of high hits or high IPV. And what we saw overall is that there was a decline, again, in participants across both treatment and control groups. There's something really funky with wave 2, although that is, most wave 2 surveys happened right in the beginning of the pandemic. And so our thought is, maybe something was going on during that time. But overall, we did see a decline in self-reported IPV over time. This is a really busy slide, so I'm only going to go over a few things, but what you see here are on your left, the response to IPV high hits in the treatment clusters, and then on the right-hand side, the response and control clusters by wave and by sex. And so the scales are a bit different here, and they might be hard for you to see, but overall, in the blue bars represent the overall response to the IPV score. The orange are women, self-identifying women, and the green are self-identifying men. And at baseline, we see, pretty similar IPV scores. It was slightly higher in the control than the treatment arm at about, 32 to 35% reporting high IPV. We saw that it was greater for men than women in both of those cluster groups. And then we saw, again, decreases over time, but some variation with respect to sex. And so this is what we're digging into a bit more with individual moderators as well as neighborhood moderators, which I won't get into, but, just wanted to mention this. And then ecologically with the secondary data, so looking at just, what's happening in these treatment and control clusters over time, and can we detect a difference? We are seeing that for domestic violence crimes. So these are 911 calls with a report to follow or a confirmed domestic violence event. A lot of limitations with 911 data. Again, we don't know that it was an intimate partner. We don't know that they were all adults. We lump them as domestic violence overall, but we did see that we had about a 3% decrease in reported confirmed DV cases and crimes in treatment clusters versus control. And in the control clusters over time, we actually saw an increase, about a 9% increase. And this is based on difference in difference models. And so that was within clusters comparing treatment and control clusters that had both vacant lots and vacant homes. And then if we look only at the clusters with vacant lots treated, again, we saw an 11% decrease in the treatment clusters and about a 7% decrease in the control clusters, but that difference was statistically significant. And then we also saw some changes, again, this is preliminary, in child abuse. So this comes from data from our Department of Children and Family Services, and we saw decreases in confirmed cases, and that includes all forms of abuse and treatment versus control clusters. Again, an increase in those clusters with vacant lots and homes for the control group. And then again, for the vacant lot only clusters, we saw also significant decreases in both, but higher decreases in treatment clusters than control. So pretty promising with respect to both cohort data as well as some of the secondary data with respect to DV and definitely some child abuse and child maltreatment outcomes. So that's all the quantitative piece of what we've done. We also had a series of qualitative interviews, both focus groups and key informant interviews. We talked about 74 residents in total. We had 51 focus groups, 23 key informants, and this took place over about 2 years, November 2019 to 2021. And our objective was really getting the narrative, trying to understand how residents, view neighborhood in relation to physical and social conditions, but how that relates to health and well-being, as well as violence, and then just experiences with the built environment and how they really engage in their neighborhoods and in their environment. And so we had many key themes. One was health and well-being, as you can expect, and participants really had a holistic view of health, which was wonderful to see. Everyone, of course, had a theme that recognized access to health promoting or negative aspects of their neighborhoods that really impact their health. So really that connection between health and neighborhood and well-being in neighborhood was strong for a lot of the participants. We also saw a sub-theme of sense of community, which is great because we talk a lot about it theoretically, it builds the base for a lot of the work we do, but seeing that, that sense of community and support and how important that is with respect to health and how neighborhood impacts that was a big theme. We also saw a sense of safety, again, kind of living in the city that has elevated rates of crime and violence. Safety is top of mind for a lot of residents, and a lot of residents felt that neglected physical environments really impact their communities and their community safety in several ways. This is hard to read too, but civic engagement was another big theme as well, thinking about how residents are engaged, perception of the role of government and improving physical spaces as opposed to residents, and just that sense of abandoned lots and what it does to mindsets around health, to health and safety, and the need to engage much more. And then youth and family violence again was another common theme across the board with folks we talked to, and the need for positive youth engagement. Residents gave us a lot of great ideas for prevention, as well as for repurposing lots. We had a whole sub question about repurposing lots and what we could do other than just the greening. And so that was exciting to see, which I can talk about if we have time. I just wanted to, again, just throw up a few of the narratives and the quotes. I think in all cases, what we see is just, the acknowledgement that neighborhood matters. It really can weigh on the psyche and the stress. So a men's focus group participant, that quote in the middle is long, but, again, kind of thinking about how it impacts the individual, how it builds unease, mistrust, really kind of the feelings of living in a disinvested area and what that can do to a person, to their psyche, and to how they may interact with others, I think is captured in that theme. The social worker we talked to the right, again, highlighted that too. Again, if people don't care about their property or their environment, it of course affects you mentally. And then the youth focus group participant, the quote on your left, really equated, getting outside of your neighborhood, like taking medicine, which I found interesting. So speaking to the fact that maybe their neighborhood was not a place they always wanted to be, and to feel healthier, they had to get outside at times, which is very telling. So a lot of challenges to this work. We came at this again as researchers, but partnered with many CBOs, but not as many as we needed across the city. And really, the time it took and still is taking, working with code enforcement and working with the city to get that buy-in was a real challenge. We've come a long way, but it definitely happened even before we started Healthy Neighborhoods Project to help code enforcement see the value in health and in what they were doing. And, could we link code enforcement with the health department and go further together, right? And so we also built them a data dashboard in the city of New Orleans that could be shared across health department, code enforcement, linking multiple sources of data. So code enforcement can also say, hey, in the places where we are greeting, what is that impact with respect to crime or violence related outcomes? The interdisciplinary collaboration was also wonderful, and it always is, but it's also a challenge too. I think coming at it from different disciplines, different priorities. Our team was very interdisciplinary. We have folks from the School of Architecture, and again, it would be great to focus on one parcel only. We came at it from the public health approach, which is more population level, and so it's been a beautiful collaboration, but definitely challenging at times. For me, the layers of community engagement were tough. We were across 23 neighborhoods in the city, and while we did have a lot of great partners in each neighborhood, they weren't in all neighborhoods, which was just a limitation of the grant and the time. And they were also very, CBOs are wonderful. We work with a lot, but I guess more grass tops than grassroots. And I think, again, we need both and needed both in this work, even if it was just building the evidence for this type of an approach. Policy and advocacy, sustainability, this is our biggest challenge. Once the grant is over, how do we keep this going? And how can we keep it going at this scale with, almost 300 properties that we've treated? The city didn't have the funds to do. Can we really build that capacity for the city, for local partners to take this on? Since then, we've been applying to many grants. We secured some ARPA funds with the health department. So the health department's really gotten on board with this. So hopefully we can keep this going much more. But again, I think it just speaks to the longer term support and change that we need across sectors for sure. And then I think our biggest challenge, and we've really discussed this with RWJF in particular, was, we're building the evidence, and this is great. We needed a large enough sample to test things. As someone mentioned before, we weren't looking specifically at sexual assault, but the evidence is still not there across the board. And how do we build that scientifically? But the reality of residents, what cost does that come to residents? We are treating control clusters now, but it was a good, 2 years plus before we intervened on some of those lots in those control neighborhoods. And so, ethically, that does come at a cost, and we really grapple with that. And what is evidence when we know it works? So hopefully we can talk more about that. In summary, though, I do think, as you all obviously are in this camp as well, built environments are key social determinants, and they are amenable to change, as hard as it might be at times. And I think, we are proceeding, though, with some caution, with unintended effects. One thing we've also talked a lot about in our team is, we're not doing much on these vacant lots or these vacant homes, although, some of them look great, but are we tipping the scale just enough to impact gentrification that might already be happening, which is not what we want to do. And so how do we really take a public health approach to changing neighborhood while keeping residents in the neighborhood, preventing, some of the unintended effects of such an approach for an intervention. So it's something we're definitely looking at longer term too. And I think for me, thinking more upstream, this has been an exciting intervention. I feel in many ways it's also a Band-Aid at times. And so we're not addressing the systems that created it in the first place. So while we change place and environments, how do we also, being at the table, have those conversations that maybe dig more into policies, other policies that might impact residents' health and how neighborhoods are shaped long-term. But I do think we can be catalysts as public health practitioners, at least. We've seen this with code enforcement, all of the diverse groups we're working with, everyone can get behind health. And so I think, it's a good tool for us to use as we think about built environment changes. And yeah, lots of questions. So I'll stop there.
Yeah. So yeah, before we hop into this poll, we have a few questions coming up, and you spoke to some of those. So thank you, Kat. The first one from Mark is a pretty specific question. And that was what was the cost per home and how close were the clusters to each other?
Yeah, it's a great question. So the cost per home vary. The cost per lot ranged from about, I think our cheapest was probably 500 to, we had a lot or two that was closer to 3,000 just because of dumping. We had a handful of lots that had some substantial dumping. For the homes, it also depended on the level of dilapidation and the work that was needed. And so on average, the home cost ranged from about 1,000. I think on the high end, we had 5,000, but the average was closer to 2,000, give or take. It wasn't much. And again, we were able to secure some deals on paint, on some of the supplies, putting that into practice. This is something we're, keeping in mind. But I think if a city wanted to do that, it is fairly low cost, or so we found. Oh, and then the distance. So they were, is it 2 miles? I'll have to confirm, but, far enough that we felt like they were similar with respect to other things that could be going on and shaping domestic violence or other outcomes, but further enough apart that we didn't want to cause any contamination. So it was about 1.5 miles or 2 miles. So not very large, but we felt large enough, but it's debatable.
Thank you for sharing. We have a few more questions in the chat, but also keeping an eye on time. We might, let's move to our next speakers, and then we can come back for questions at the end. And if not, we can answer them in some follow-up. But please keep putting your questions in the chat, and we can also skip this polling question if that works for you, Kat. Well,
Yeah, for sure. And I can answer them in chat while we move on.
Great. Thank you so much.
Thank you.
Or go ahead, Lisa.
Yeah, thank you, Kat. Yeah, great questions in the chat and an amazing study. And we're gonna look forward to hearing your responses to the questions via chat. And I'm excited to introduce or reintroduce our next presenters, our friends at the Michigan Coalition Against Sexual and Domestic Violence. And many of you probably know Josef, Canaria, and Amanda Barratt, but just so you know, Amanda's a senior program director and Josef is a program manager at the coalition working to prevent domestic and sexual violence throughout the state. And wanted to, we're excited to bring you back for session 2. And I think one thing that's really neat about having you present to this audience of all grant recipients is the fact that you are engaged in implementing with CDC support. So we look forward to hearing more about what that has looked like for you and what you can share with the other recipients. And also appreciate you just doing a brief recap of session 1. So turning it over to you. Thank you so much.
Thank you so much. We are so excited to get to be here today. Like you had said, I'm Amanda Barratt. I use she, her pronouns. I work at the Michigan Coalition.
Yes, and hello everyone. My name is Josef Canaria. I'm also part of the Michigan Coalition and my pronouns are he, him, his. And yeah, as Lisa, you were saying, we are a recipient of both Delta and RPE. So I know this audience receives either of those funds or both of those funds like we do. And so I think it's a really cool opportunity for us to be able to share the lessons learned around the greening work that we've done with Delta Impact, the previous iteration before our current grant Delta Ahead, and how we're kind of taking those lessons learned to the work that we're doing now. So that's what we're going to really spend the next about half hour talking about.
What a great segue point for us to even be able to start this conversation with that essential elements document. And we were really excited to get to work with our CDC partners to get to develop that. As we were doing some of the work, sometimes it is challenging to do work and not have as many documents to kind of work with engaging stakeholders. And that essential elements document has allowed for us to be able to be a part of conversations, even though we didn't change aspects of our work. Sometimes having documents like that give us more credibility to be able to engage in conversations. And I think that our partners at the CDC recognize that. They listened to us. They wanted to help us, be able to have some of these tools. Joseph and I are going to talk about a lot of the different tools that you might need to use. And that definitely is one of them. There always are folks who have questions about our evaluation data, about some of our metrics, about implementation. In fact, lots of people have said, I'm really interested in greening and growing work. Can you just tell us step by step how to make this happen in our community? And I think that they get frustrated with our answer, which is no, because we don't know your specific community. And the biggest lesson that we've learned is this has looked different in every single community that we've been working with and partnering with. And so there is no copy and paste exactly to get these efforts going. And that, I think, actually gives folks more permission to really lean in to their own communities and their own stakeholders and their own unique attributes that they're going to be able to bring to this work.
Absolutely. Thank you for bringing that in, Amanda, because we have to also be honest. And when we were doing Delta Impact work, we were also figuring it out and pivoting as the days went, right? Like when the grant started in 2018, we had no idea that a global pandemic was going to come crashing down, right? And so we had to learn and pivot and adjust and then kind of figure it out together. And so we're really grateful that the CDC allowed us to do so. And we're now at a point in our movement where, it's something that could be work that you all are doing in your states, and something that because it's a shared protective factor across all various forms of violence that is really interesting and something that we can really uplift. So we're really grateful that we had these funds to kind of figure it out together.
Yeah, so if you watched the previous webinar, we talked a lot about our Delta Impact work, which was from 2018 to 2023. And today we're really excited to talk about some of our Delta Ahead work, which is a grant that started in 2023 and goes for 5 years. And for our impact work, we showed examples of a lot more greening in urban spaces. And our focus now is greening in rural spaces, which we started to explore at the end of our last grant cycle. And now we are very honored to partner with Hope Shores Alliance in Michigan that serves 5 rural counties to be able to look at greening in rural areas. And a lot of the time, Joseph, we get this question all of the time. It is, why would you look at greening in a rural area?
Right? It's like the rural areas we think of are already green, right? But I think that we're operating with a definition of what is greening to us. It's this idea around social cohesion and community connectedness, right? It's not that presence of literal trees or grass that makes a space quote unquote greening in our definition is that it's the fact that, is it accessible? Is it equitable? Is it safe for all people to come and congregate and build community with one another at, right? It's something that we're really interested and excited to learn about in the next 4 years is, can we kind of apply the lessons learned from impact in a rural community? Right? Does it still work the same? Right? Or are there enough barriers to where and challenges to where it might not work the same? But we're ready to find out. And so we're really excited that I know earlier, Janae and Ashley brought up the podcast episode that Hope Shores Alliance and Sarah, also are part of our team, was able to talk about. So really check that out. It just dropped earlier today, but they're going to be the ones who are going to be really on the ground doing the work. They are our sub-recipient through Delta, and they're the ones who live in the rural community, and we're really excited to support them and figuring all that out together.
Yes, I think that when we've been engaged in conversation with Hope Shores and really just talking about this work in general, when people are thinking of those green spaces, even when we were driving around the 5 counties, it is hard because people will say, I see green spaces though. But we have to ask, who can access those spaces? Who has access to those spaces? Because if people can't utilize them, then does that have the same preventative measures as a community-based space? And so we talked about looking at 3 big factors with greening and growing work, which is community, building connection, and sense of belonging. And rural areas have similar problems. They look differently sometimes than in urban areas. So we still see high rates of violence in the areas that we're looking at. We have issues like lack of access to food, increased need for community. And sometimes it can be hard because you might be driving by farms all of the time. And so when we're telling people that there are food deserts, there's lack of food access, people might say, well, there's food all around, not knowing that sometimes the crops that are being grown aren't for human consumption, not knowing that people still might not have access to those things. And so when we're looking at why are we trying to do this in rural areas, people need community and belonging and connection in rural spaces too.
Absolutely, right? Because I think beyond just all the things you listed, like, are there transportation issues? Like, in the most literal way, can people come together? There's other ways in which poverty manifests itself differently in rural versus urban spaces, and other education gaps and employment gaps and other economic justice issues that just looks differently in rural spaces. And so is addressing this protective factor in this type of community gonna work the same? And we're ready to find out. And so we, like, right now, we're really pivoting to shifting, like, how can we create spaces of belonging, connection, and community, like we talked about at our last webinar a couple of weeks ago. And so right now, to be fully transparent, we're wrapping up year 1. Laying down the foundations to really get the ball rolling. Mm-hmm.
And I think when we look at what does some of year 1 look like, what does some of this greening work in rural spaces look like, a lot of it is for our community that, they're saying a big priority for us is to start doing this work internally as we're engaging with community. And so for them, it looks like creating a garden in a shelter space and looking at people who have been displaced by because of violence. How can we incorporate greening and growing for them to be able to access? And for a lot of rural areas, greening and growing is a big community principle. It's a big values-based principle. There are a lot of agriculture-based groups. This is a way that people have connection to land, have connection to growing. And when people are entering into shelter, they're being displaced by violence. Oftentimes they have to leave some of those things. And so Hope Shores is planning on building a survivor-based garden, doing survivor-based programming around growing, greening, having a lot of those aspects within that, in order for them to continue to build relationships in community, in building relationships with folks who are doing this work, and being able to really spread this work throughout the community.
Absolutely. So I think with that in mind, like we're gonna apply the lessons that we learned from Delta Impact and a lot of the things that we helped informed the Essential Elements document on like understanding that we have to rely on the small incremental change. It's not going to happen overnight. That relationship building and building a sense of connection and belonging can't be done in a year. It might not even be done in 5 years, right? By the time Delta Ahead ends in 2028, we have no idea in terms of what the impacts are going to be. And so we just have to really keep that in mind. And as long as we live within our values and know that we are listening first and that we are being authentic, honest, and vulnerable, we are hoping that, our evaluation outcomes will actually lead us have some measurable change, but we don't know that yet. But at least we can know if we follow these things that we found out around greening with Delta Impact in urban spaces, then we can kind of pivot in the next iteration of Delta.
Yes. You can't do everything, right?
Mm-hmm.
And reminding yourself that. I think that allowing for flexibility. We are so grateful that we were provided flexibility, as we had to have multiple pivots during our last funding cycle. There were a lot of issues that came up really since 2020. We really had to rethink, how are we as a coalition doing this work? We had, at our coalition level and at both of our sub-recipient levels, significant staff turnover, as well as I'm sure many coalitions and many agencies also did see that happen. And so for us, it was really about leaning into what our values are, and recognizing too that not only do we need flexibility for planning, when you're working in different communities, even different neighborhoods, even different blocks, you can't always have the same strategy. And so that's why I think when we look at even like what were some of our essential elements, when you think of like, what are the messaging, what is the design components, how do you even work around policy components, that might look very different community to community or area to area. Who is a stakeholder, a champion, a leader in one instance might not be the same in another area. So we, Joseph and I talked about examples of greening in Detroit and greening in Dearborn, which are geographically very close together, and the strategy ended up looking very different. And then when we started trying to implement greening in a rural space, we recognized that we needed a very different approach than what we were going with. And so now that we're looking back and saying, how could we have had a greater impact? Some of that is, did we too heavily rely on the strategies that we used in urban areas on a rural area? And I think the answer is yes. And so for us, giving ourselves permission to be flexible, giving ourselves permission that it actually shouldn't look the same, right? I think we would have been doing something wrong if it always looked the same.
Right? Yes, thank you, Amanda. Right, the fact that we worked in two different communities that were 15 minutes apart. The drive between Dearborn and Detroit is 15 minutes, but our strategies had to look vastly different because of the people who live there and their sense of community. And so now that we're going to be focusing in on the 5-county area in northern lower Michigan, when we visited, every 30 minutes, we were hearing stories about how, oh, this part of the town and this part of the county feels super different. This to them is a big metropolitan area, and it was a town of 10,000 people, right? And it versus everywhere else around them. So we are also having to be cognizant of the fact that even going to be doing this work on a rural environment is going to look different from block to block every 15 minutes apart from one another. And that's why we have to really rely on the people informing us on what that looks like to them. What does it look like to them to feel like that they feel connected and belonged? Because it's going to look vastly different to someone who lives 20 minutes down the road from them. And so those are some things that we learned when we trying to find a common ground between the organizations we partnered with Delta Impact was like, hey, like, did you know that you don't have to do anything extra? Like, your mission is already perfectly aligned with ours because you all are addressing food deserts. You all are already revitalizing urban and vacant lots. But did you know that also reduces violence? And they were like, oh, no way, amazing. And we didn't have to do anything more besides help amplify their mission, besides volunteer at their events and really get folks involved because we didn't want to ever think that we knew better. And so we're going to continue that with those lessons learned in a rural area and have them lead the conversation, have them lead the efforts, because we don't want to ever think that our fancy CDC dollars is going to fix the problems that's in their own backyards.
I think that when we have been looking at greening and growing with primary focus on building social cohesion, building connection, building all of those pieces that make us feel more in community, we have to look at isolation. And so when we think of how isolation drives disconnection and how rural communities are often impacted by isolation, that helps us in some of the planning work for this year. But also, a lot of our team has connected back to the isolation that we felt sometimes while trying to do this work as a state coalition. And really particularly when a lot of our plans had to pivot during 2020. And so I think that when we had people who reached out, sometimes it would even be another coalition call. So we would sometimes be able to connect with like the Rhode Island coalition, who was also looking at greening work, and even getting to hear from them and feeling supported by them. It made us feel less alone in doing this. And that's a strategy that we have used for this funding cycle. Is the last time we were trying to implement and support the implementation at a local level. And this time we are really focusing, supporting at a local level in a different way. And so like the level of support that we're now able to provide looks so different. Our capacity and our prioritization of being able to support our partner is a huge priority, because without that support, we are not going to end up seeing the level of success we hope to be telling you about 4 years from now.
Yes, thank you, Amanda. For sure. I think a lot of what we learned with impact is that we have to rely on relationships, right? I think it's something that is crucial to our work, that we can't do this alone. It's almost antithetical to our work of doing this alone. And so I think with that in mind, we're really then going to be relying on the voices in the community to help inform us and asking them what they need, and really getting them seated at the proverbial table of prevention work. Because oftentimes we have done this always so siloed, that we know better, that we are the ones that can come into your community and fix it for you. But we are really tried to kind of unlearn that and think that that's actually more harmful than anything else. And so we're really excited to see what the next 4 years has in store for us in that way. So with this, I think we also want to talk about our evaluation considerations. Amanda and I have already brought up that it's not a one size fit all. It's not a copy and paste. It can't just be like a fancy toolkit that we hand over and say that you can do this everywhere throughout the state in every community, because each one is so different. Each one is so unique, and even it can be 15 minutes apart and they're vastly different. And that we might need to be focusing on, and we will be focusing on, on qualitative data versus quantitative data, because of the barriers that rural communities have of the surveillance data that's out there, right? It's really hard to measure the same things that we measured for impact in the same level because of just how rural communities are built and structured.
Yeah, I think that is a really great point when we're considering how do we have good metrics? How do we measure this? What does this look like? A lot of time, like initially what we were thinking was, okay, we're going to measure impact by how many people access these green spaces. If we're going to build that, how many people went to them? And then we're realizing, does that tell us about community connection though? Does that tell us about social cohesion? And so when we look at some different indicators, we focused on percentage of parents who feel the neighborhood is safe for children, rates of violent crime, the percent of children that witness community violence, percent of gun carrying by adolescents in the last 12 months, school attendance, and that is all related, kind of the umbrella of community violence.
Yes, and then we're going to also look at just the different statistics that can inform social cohesion levels of, like, how do neighbors interact with each other? Is it the time spent in public spaces, the increase of volunteerism rate, attends community events or meetings, civic participation? Are there increased voting registrations in the various zip codes in the rural communities that we are going to be working in? And so these are things that like we're going to have to measure in some capacity, but a lot of the things we're going to really hope to rely on are the voices and stories of the folks that are going to be using the green spaces that Hope Shores is going to develop.
Sorry to interject, Amanda and Joseph, but I wanted to just get a sense of where you were at in your presentation. I know you had a chat question you wanted to pose. There are also 4 questions that have come up in the chat. So which would you prefer to do now? You want to respond to the questions in the chat, do your chat question, or continue with your presentation?
Yeah, that's we'll do our chat question, and then we'll save all the rest of the time to answer folks' questions. And if we do not get to your question, please email us. We love to work with all of you. We're really passionate about this. I know a lot of you on this call might be in the midst or on the cusp of grant writing, and this is definitely a strategy that we hope that more folks consider. So our email is on a slide, or if someone can paste it into the chat, we would love to connect with you.
So with that in mind, we did this at the part 1 of this webinar, but we want to ask all of you, when you think of the word connection, what does that mean to you? Like, how does that word feel for you? How does it resonate with you? How do you feel like you are connected? And whatever that means, I don't even want to define and provide any extrapolation of what connection means. Like, when you think of that word, how would you define it?
What does connection mean to you?
So you can throw that in the chat box.
The opposite of loneliness. Connection. Oh, let me go back to the chat. All right. Connection, not alone, known, love, and belonging, feeling comfortable in being in spaces with others, feeling a sense of collective well-being, belonging, to feel seen and included, ability to depend on someone, to have something in common, a sense of belonging. It means safety, trust, and belonging. Aware of my own strengths, needs, ability to be responsive to and appreciative of others' strengths and needs. A dance of give and take, to feel heard and okay among others. I know people and they know me. There are people I can call for company, for laughs, for help. Connection is interpersonal relationships that help you feel like you're safe, secure, accepted, and included. A sense of mattering, knowing resources. Belonging, to feel safe, being vulnerable. A sense of investment. Provide safety. Is there anyone in my life who will take me to the hospital in the middle of the night? I think levels of connection for a moment or longer. This varies. Someone who cares for me versus someone who is tight with me that I can rely on, or who they might rely on me. Support and ability to work toward a common goal. Willing to compromise. Thank you for that.
Yes, thank you all so much for that, right? Like what you all dropped in the chat box is what we hope to be creating in our prevention work, right? We really hope that the folks that we'll be engaging with in the service area that Hope Shore serves can walk away with what you all just dropped in the chat box, right? Because that's what we know then is that sense of community connectedness, which is that shared protective factor that we're all working to create, right? If people feel like they belong and there's a sense of mattering and whatever they look like, they feel heard, then awesome. Like we don't even need to explain all the benefits of that, right? And so that's what our goal is to kind of make it so everyone that we're serving feels what you all just dropped in the chat box. All right.
We have time for any questions?
That is a good, yeah, I think, so there were 4. I'm gonna go with Laura's question because it sort of brings us back to how this all got started. And Suzanne, thank you for your questions. We'll try to reach out to you to get your 3 questions addressed afterwards. So Laura asks, how did you assess that working on place-based strategies and greening was the approach that would fit or was desired in the communities in which you are working?
Yeah, no, that's a really great question. I think that was something that when we were working on just the general application of Delta Ahead and trying to work with potential partners, that was something that really just came up. It's like, okay, well, what have you all done before? What were some things that have you all worked on? And we brought that up, and that was something that was really appealing to our partner now. Of like, okay, well, it sounded like that was successful for impact. What are then, so we can maybe let's try that here. So like we're currently working, yeah, Hope Shores Alliance is a survivor serving organization, both DV and SA. And so they were really helping us inform the work that we're doing in this current grant cycle.
We're also really fortunate that staff at Hope Shores actually have lived experience doing this type of work, doing community garden work, getting that started. And the community has investment in growing type work. So they have said, you know, this is something that we can meet our community where they're at because this is a community priority. So it is really exciting to be able to take something that people have momentum on and be able to connect it then to violence prevention and in a way that we didn't get to do under our last grant cycle.
Thank you so much, Amanda, Joseph. We're at time, so I'm going to wrap us up, but I really want to give such a warm thank you to Amanda and Joseph and Kat and Calla. We had 4 amazing, generous, wise presenters today sharing their work. So let's give them all a round of applause and congratulations on your good work. I think that presentations just raised a lot of complexity and nuance and really underscored the essential elements that Calla talked about, particularly building community power and engaging residents and partners, looking at consequences and building power and capacity within the community, all while really working on these different aspects of the natural and built environment. So thank you all. Look forward to continuing the conversations through various Prevent Connect channels, and we'll definitely follow up with you, Suzanne. And back to you, Janae, to close us out.
Great, thank you, Lisa. And speaking of evaluation, for everyone who is attending, as you exit Zoom, you'll be prompted to take a very quick survey. Please let us know what you liked, what resonated, what didn't, how we can improve. That would be really helpful. We will also send that survey out along with a recording to this web conference and all of the links and resources that our presenters mentioned to your email in the coming days. So thank you all so much. We really appreciate you. I'm going to reopen the waiting room as we close the meeting. So if you get booted, that's why. And if our presenters could just stay on for a few minutes, we will check in. Thank you all so much. Have a wonderful Tuesday.